Hello, good evening everyone. Welcome to our live session today. So I'm Dr. Melissa here and this is my colleague.
I'm Dr. June. Hi.
Hi. Okay, so today is a very exciting session because we will be exploring an important issue or topic that everyone don't really realize. That's the connection between our gut, that is our intestine, as well as to our skin.
Yes. So actually, over the past 10 years, there has been researches on our gut microbiome, which is the bacteria, fungi, viruses that stay in our intestine, and see how it related to our skin. Yes.
Yes, okay. So when we talk about eczema, so people always think that it's just skin, redness, itchiness, inflammation, swelling, but they would never think that there is a connection with the gut. So it's actually a reflection of what's going on deep inside our body that is more than the skin. So today we will be exploring this connection.
So, first of all, before we entering to our whole topic, we can go through some myths.
Myths, yes. Okay.
So the
yeah.
first myth is eczema just a skin condition? Yeah. So
Okay.
what do you think?
Okay, so definitely is a no because we have already disclosed the answer. So eczema is more than just a skin condition because eczema is often due to our internal body inflammation as well, your gut inflammation, and also your environmental triggers that can make the eczema worsen. So the skin is just a presentation, but the problem is actually deeper. That is our body inflammation, the gut inflammation. Yes. So next.
So next, is topical cream are all you need for eczema?
Yes,
So,
Dr. Jun, what do you think?
Yeah, the answer is actually no. Yeah, so cream like steroid cream or moisturizer cream, it just control our symptoms. But actually, eczema is more than the skin condition. It's because it related to our inflammation, our immune system. So we don't just control the symptoms, but we actually need to find out what is the root cause, and from there only we can treat eczema more effectively. Yes.
Okay. So number 3 is steroid cream. Is it a must for eczema? So actually, this statement is it can be right or it can be wrong. Okay. So steroid cream, it is a must when your skin is inflamed, your skin is red and itchy. However, if your eczema skin is in the remission phase, okay, there is no redness, itchiness, or there is no swelling, you don't have to use steroid cream. You can just maintain with lotion with ceramide. So it depends on the condition of the eczema. Okay. And the next myth is diet has something to do with eczema. So Dr. June, what do you think?
So yeah, diet. There is a connection between diet and also eczema. But we not only control our diet, but actually we need to look internally to our gut health as well. Then only it can be the eczema only can be controlled and treated more effectively.
It means a combination.
Combination, yes, and also some certain food may trigger. Some food may help. Yes.
So the next one is children will just grow out of eczema. Yes, this is the saying that a lot of elderly will tell the younger generations, don't worry, your children or your child will just grow out of it once they grow up. Okay, this is actually not really true, okay? Because some children, they might improve over time, but some children might not, okay? So those children who not improve over time, that means those with eczema, actually signify a chronic inflammation in the body as well as the gut. So it is not really true, okay? Because early support can actually make a huge difference if we actually intervene earlier, the gut and the skin. Yes.
So the next one is if eczema runs in family, there is nothing you can do. So the answer is not really. Yes, we can see that some people they tend to have eczema if their parents or their siblings have eczema, but that doesn't mean that if they have, you must have it too. Because with good gut health, nutrition, and also by a good lifestyle approaches, then it actually can decide how your gene express and to decide whether you will have that eczema symptoms and flare-ups or not. Yes, so next we can move on to some diet that practicing by people who are having eczema. So one of it is the elimination of diet. Yeah, so what do you think about this diet, Dr. Melissa?
Okay, so actually my customer actually told me that they have tried different kind of diets, and this is one of them, elimination diet. Okay, so this elimination diet is actually practiced among children, especially when their parents realize that they get certain flare of eczema after taking certain kind of food. Okay, so the parents will try to avoid asking their children to avoid certain kind of food, and those food are example, the cow's milk, the eggs, the wheat, soy, peanuts. Okay, these are the common ones. But actually, this is not a really good practice. Okay, because not every flare of eczema is food related. Okay, so as what we have explained earlier, it could be environment, it could be stress, it could be skin barrier issue, genetics. So by limiting the choices of food that the young kids are actually taking, it can actually lead to more severe issues such as malnutrition. So elimination diet is actually not really worth it if you rethink over it. Yes.
Okay. So, how about carnivore diet? I heard some people practicing it as well.
Yes, I have a patient, a very young man of about 20-year-old, but with chronic eczema since birth. And he came to me, actually told me that he's practicing carnivore diet and he see improvement in his skin, but still it can flare up on and off. Okay. Okay, so carnivore diet, what is it? Carnivore diet, as what the name suggests, is actually just remove all the plant-based food in your diet. That means you are taking only animal products such as meat, fish, eggs, and also sometimes dairy. Okay, so there will be no fruits, vegetables, no fibers, no vitamin C in your diet. So why some people try it? Because by taking this carnivore diet, it can actually experience a short-term relief, because carnivore diet actually it removes all those common triggers from plant-based, such as the soy, the nuts, the wheat, okay, the legumes, and even some other kind of plants. Okay, so by elimination these common triggers, so some people may experience short-term relief. And also by removing these what we say plant-based, we are actually, by taking carnivore, we are actually also removing processing food. Okay, so patient will actually realize an improvement, but it's actually very short term only. Okay, so by taking this carnivore diet, will you recommend your patient taking this?
Yeah, from the description, explanation, I think this carnivore diet is actually the risk is outweigh the benefit. Yeah, it may relieve the symptoms for
Temporarily.
temporarily, but for long run, it actually is not really healthy for our body. Yeah, as we cut out all the plant-based food, then all this plant-based food is actually very rich in fibers, and this fibers is actually a good food for our gut microbiome. So yeah, by cutting out all these plant-based food, then we will lack of fibers, and also our gut the lack of the microbes in our gut will lack of food, then
Then they
our
will
gut
die.
will eventually become not healthy, and this will trigger eczema. So that's why carnivore diet cannot be the
Long-term solution.
long-term solution.
So carnivore diet can only act as a short-term reset for some people, but for actually most of our eczema patients, we actually recommend a more balanced diet, which includes, of course, the meat and as well as the fruits and vegetables. Okay, more diversified, but of course more whole food, no processing food, which is a more safer and more evidence-based approach for the patients. Yes.
So, Dr. Melissa, you mentioned that eczema is not just a skin condition. So, what actually it is?
Okay, so first maybe we will go through what is the common presentation of eczema first. Okay, so eczema is also known as atopic dermatitis or dermatitis. It's a very chronic, that means it's a long term, it's not a 1-2 day skin condition, it's a month. Maybe patient will come in here with presenting with month or even year condition, okay? And the skin will present very itchy, red, okay, dry, and also swollen. So commonly it will start in the childhood, that's what we say, okay, but it can also affect people of all ages. So we have seen actually patients coming in from babies to children up to elderly people having this eczema problem. So people won't just grow out of eczema. Some children, yes, okay, but it actually affects all age group. But commonly it starts from young age, yes. And of course, the causes of this eczema is multiple. It can be due to the genetic, the skin filaggrin gene expression. It can be due to our immune system, can be due to food trigger, environmental trigger. Okay, so maybe Dr. Jun, you can explain to us more on what's the difference physically between the healthy skin and the eczema skin.
So, from the picture that shown in the screen, we can see that over your left side is the normal skin. So in our skin there is an outer layer which we will call as an epidermis, and the inner layer is the dermis. So in healthy skin, the outer layer is intact, the barrier is intact. So any irritants, allergens, or any bacteria cannot enter through our skin easily. But in eczema, which is also called dermatitis, the picture on your right side, we can see that the outer layer of our skin is broken. Broken. So the barrier is broken, then the irritants, any allergens can enter our skin very easily and triggers the inflammation and the immune reaction and cause eczema. And also in normal skin, because of the skin barrier is intact, the water in our skin, the moisture in our skin will not escape from our skin that easy. But in dermatitis, because of the barrier is disrupted, so the moisture in our skin will be lost to environment more easily and cause dryness.
Okay, so what are the symptoms of eczema? So common symptoms, as we can see in the slide, is actually dryness. Okay, it started off with dryness, and then there will be itchiness, and then redness, bumpiness, and then irritated skin, crusty and flaky skin, and also oozing skin. Okay, and of course, if any infection, like what Dr. Jun said, eczemated skin are very prone for infections because the allergens can come in very easily. When infections happen, then there will be superimposed infection which we have to treat further as well. Okay, but the hallmark feature of eczema is actually intense itching. Okay, and of course in children it can happen in the cheeks, the scalp area, and also the extensor. Whereas for children, adults, it's normally in the flexural area, the flexus area. Yes. Okay. So next we move on to always my customer or patients will tell me they have tried different types of creams or different types of remedies, but it keeps coming back, the eczema. Okay, so indeed, eczema is a chronic inflammatory skin condition which can flare and remission and go into remission up and down, we say, okay, over time. So, however, we can actually stabilize it if we treat the root cause. So, what the patients or the customer have been doing is actually just treating the symptom and not the root cause, which is the gut, the immune system. That's why the problem of eczema keeps coming back. Okay, so topical creams such as steroid, antihistamines, as well as moisturizer are mainly for symptomatic control. So just treating the symptom and not correcting the underlying immune imbalance and also not correcting the skin barrier protein defect. Okay, so conventional treatment like topical creams are actually good, but of course combination treatment, which is actually treating the root causes from the immune balancing as well as the gut health, is a more holistic or a better approach, yes, to achieve a better control and also a long-term control of the eczema.
Yes. So just now, earlier on we have talked about like what causes eczema and then what are the common diet that practicing by people, yeah, and also we have talked that conventional treatment alone cannot treat eczema. So all these they bring together, bring us to know that eczema is just not skin problem, but also gut health is very important. Okay, so yes, so from this diagram we can see that in our gut there is a gut villi. Okay, so in this gut villi there is a trillion of gut microbiome. So this gut microbiome, when they are in balance, they can help with the gut integrity and also to balance the immune system, reduce the inflammation. Yeah, so and help our skin to stay strong. Yes. So we can see from here that how gut and skin is connected. Okay. So first of all, like what I said just now, our gut have a lot of microbiomes that's good and bad. So when they are in balance, okay, they can control the immune system in balance so that our immune system will not out of control. They will not react to something that is harmless, okay, that which doesn't usually triggers our immune system. Okay, so also when we have a good quantity of root microbiome, they can produce something called as a short chain fatty acid by digesting the fibers. Okay, so this short chain fatty acid is very important in giving our gut cell energy and also to build up the gut integrity and also help our gut to absorb nutrients more efficiently. Yes, so that our skin will get our body and our skin will get all the good nutrients, and also this short chain fatty acid also will reduce the inflammation in our body. So yeah, by then also it can reduce the inflammation that triggers the eczema flare up. Yes. So if our gut barrier is disrupted, okay, then it will affect our skin health as well.
Okay, so if we are only treating the skin, we are actually missing out the bigger picture, that's our gut and also immune system. So from what you have explained, the gut is really the control system of our skin as well. So eczema patients, normally they will have underlying gut symptoms as well. This is what I realized because most patients, when they come in with eczema, when you ask them whether they have any gut symptoms, they will say, yes, doctor, I have bloating, gastric, constipation, lethargy, tiredness, all this. So this is actually a sign of microbiome imbalance. So what are the common signs of microbiome imbalance? You can check whether you have this as what listed here. So number one is actually the most common one, that is bloating or feeling gassy. So any time of the day. Number two is the constipation or diarrhea. Number three is fatigue or low energy, okay? Because your gut is where the nutrients are absorbed. So if your gut microbiome is imbalanced, it can actually absorb more toxins and it can cause nutrient deficiency and also low energy, because nutrients are important for energy production by our cells.
Yes.
Okay. Number four, you will have a skin problem, and the common one that we are talking today is actually eczema. And then five is actually mood changes. As what most of the people not know, gut is actually the production center of important neurotransmitter such as serotonin as well, which control our mood. Okay, so if you have poor gut, you will have a poor mood as well. So that's the relation of the gut-brain axis. Okay, and then the last two will be increased sugar cravings, which will then lead to increased body weight, okay, or weight changes. Okay, so these are the common signs of microbiome imbalance that patients usually present to us as well, besides the skin concern.
Yeah. So when you have all these symptoms, then it might indicate that you might have gut health problem as well. So yes, other than gut affecting eczema, maybe some of you who are experiencing eczema problem will realize or found out that your eczema flare ups at some time, especially during stress period. Yeah, stress period. Then why is this so? There is actually reason behind it. Okay, so from this flow chart, we can see that when we are stressed or when we are facing any emergency situation, our body will naturally produce a hormone to face all these situation, which called the cortisol hormone. Okay, so it actually is a good hormone. We need it when we are in stress situation. Yes, but if we are overstressed or the stress is like continue for a long period, then our cortisol in our body will be very high. So when it's very high, it's not good as well. Okay, so it will disrupt your immune balance. So your immune will out of control. So you might don't have the ability to fight infections, and then in other way around, you may easily react to something that is actually harmless to your body.
That means become more sensitive.
More sensitive, yes. Okay, so it will attack your own cell or attack like certain food. Yes. Okay. So and also when the cortisol level is high and your immune system is imbalanced, it can affect your gut as well. So yeah, like what we mentioned earlier on, what will happen when your gut is out of balance. Okay. So all these combination together, then it will triggers the inflammation. Okay, then immunity out of balance, and eventually your skin will flare up.
So in short, stress can actually trigger your body to produce more cortisol, which will actually cause your immune system to go down and cause leaky gut problem and cause your skin eczema to flare. Okay, so this is why stress management is not just about taking care of your mental health, it's also taking care of your skin health. For many of the patients, even when the diet and creams are controlled, their eczema still worsen if they have continuous stress as well as high or very severe stress, working in severe stress condition. So what are the factors that can affect or trigger eczema? As one mentioned, the first one will be diet. So food that is high in sugar, such as refined sugar, okay, especially fruits, okay, such as mango, watermelon, dragon fruit, okay, they can trigger eczema, okay, And number 2 is actually processed food, processed dairies especially, such as cheese, okay, cookies, chocolate, dessert, any kind of dessert from dairies. And then number 3 will be alcohol and also gluten. These are the examples of food that can trigger your eczema flare. Okay, because these are the food that weaken your gut as well. So it can trigger eczema flare. And number 2, as what Dr. Jun has mentioned, stress. Stress can also trigger eczema because it can actually increase your body cortisol level, then weaken your gut and immune system. Sleep deprivation as well. Okay, and number 3 will be hormonal change and immune disbalance, okay, which is due to the gut and related to it as well. And the last one, common one, is actually antibiotic usage, because by taking a course or prolonged course of antibiotics, it can actually kill all the good and bad bacteria in your gut. So your gut will eventually, or the villi will eventually become bald, okay? Then your gut health will be severely disrupted with these antibiotics. So that is why, especially when our patients, when they are taking antibiotics, we will advise them to take probiotics as well to actually boost up their gut microbiome. Okay. So next, we move on to what actually you can do at home besides avoiding those that we have mentioned, the triggers. Okay, so we move on to the examples of probiotic rich food. Okay, so what are the best probiotic rich food? Actually, probiotic rich food, what is important here is the food must contain live culture bacteria. Okay, so the example of food here, actually you can go through together. The first one from the left side will be the buttermilk, and then the yogurt, miso, a very popular Japanese soup, and then pickled cucumber, sauerkraut, kefir, and then moving down, tempeh, kombucha, okay, which is a kind of black tea, okay, and then certain kind of cheese, some aged cheese, such as cheddar, parmesan, and then natto, as well as the Korean famous kimchi. These are actually probiotic rich food, okay? So that you can actually take to boost up your gut health, okay? But not all fermented food are probiotics. So just as what I've mentioned, you have to take live, cultured, active cultures when you are taking the food. That's the more important one.
Yes. And it's only effective to your gut health.
Yes.
So So how about anti-inflammatory meals? Does it help with our gut health as well? And
Okay.
eczema?
So as the name suggests, anti-inflammatory. Gut health is actually a kind of inflammation. I mean, when we have gut imbalance. So anti-inflammatory meals actually is a good choice, okay? Because it is usually a balanced diet that emphasizes on whole, nutrient-dense food and avoid those highly processed food and pro-inflammatory items. So it's not just only good for eczema, it's also good for overall health as well. So what is an anti-inflammatory meal? So as you can see from the diagram, it's actually a plate of meal that consists of first healthy fat. So the healthy fats that we are talking about here are healthy fats such as from the avocado, from salmon, from the olive oil. These are the healthy fatty food, okay? And then it also contains colorful vegetables and also fruits, which is the source of our fiber, our vitamin C. So examples here are the broccolis, the berries, the leafy vegetables, okay? And then next is the whole grain food, such as oat, barley, brown rice, which provide fiber to support the gut microbiome. And then also lean protein, such as the fish, tofu, lentils and beans, herbs and spices such as turmeric, and also the probiotic rich food that I've mentioned can be included as well in the anti-inflammatory meal. Yes. So what to avoid in anti-inflammatory meals, Dr. Jun?
So anti-inflammatory. So the reverse is pro-inflammatory,
Okay.
which triggers food that triggers inflammation. Yeah, so those food that can trigger inflammation is such as processed food, okay, or those sausages.
So no
ham,
processed food.
Yes, no processed food, and also refined carb, okay, such as like white bread, pastries, all these with refined sugar.
Refined sugar.
Yeah, it can destroy our gut health, our skin health as well. Okay, and number 3 is sugary drink, excess sugary drink. You should avoid it as well. Okay, and deep fried food, yeah, it's very yummy, but it's very unhealthy to your gut and your skin. Okay, and also alcohol. Yeah, alcohol as well. Do not take excess alcohol. Okay.
Okay. So no processed food, no refined carbs, no alcohol, no sugary, no KFC.
Yes.
Okay, great. Okay, so in summary, an anti-inflammatory meal is actually a focus on whole food, no processed food, okay, and then healthy fats with fibers and antioxidants as well as spices, while avoiding processed and sugary stuff. Okay, so let's move on to besides avoidance and also taking probiotic-rich food, anti-inflammatory meal, what are the other supplementations that we can take to support our gut health? So, supplement-wise, the first and foremost, of course, is the pre and probiotics. Okay, pre and probiotics are good bacteria that actually colonize our gut to protect us from any toxins from outside. Okay, so pre and probiotics, you can focus on lactobacillus and also bifidobacterium species that is actually more targeted for skin health or eczema health. So that's the first one. And of course, probiotics, you have to take it consistently every day for at least 6 months. Okay, because probiotics, it takes time for it to colonize and also reset our gut. Yes, so at least 6 months to actually see the improvement in skin condition. And number 2 will be high fiber food. Why high fiber food? Because high fiber food can actually promote the survival of probiotics as well. Okay, high fiber food is actually the food to the probiotics, so high fiber food is good. Okay, number 3 will be anti-inflammatory supplements such as turmeric, vitamin D3, especially high dose of vitamin D3. Okay, next will be omega-3 such as the fish oil and then zinc. And lastly will be L-glutamine, if you know of, is actually one of the most essential amino acid. Okay, because it helps to tighten the gut junction. That means it prevents leaky gut. Because leaky gut is the condition where the gut junction is leaky. So L-glutamine is an amino acid that promotes the tight junction between the gut cells. So it's good because it prevents toxins from coming in easily, as well as the nutrients from leaking out easily. Okay. So Dr. Jun, can you share with us, besides taking care of diet, taking more good supplements for gut, what are the other things or other lifestyle approach that we can do?
Yes. So yes, other than diet, okay, yes, and also supplements, there's something else that we can do in our daily life also, such as for releasing stress. Then we can do like yoga, and meditation. This will help to reduce the cortisol level in our body and let us to be mindful and also relaxing. Okay, and also for your sleep is also very important. You need to have a good sleep, if possible, to maintain at least 7 to 8 hours of sleep. And also some tips for before sleep to get a good sleep hygiene is you have to dim your light when you want to go for bed, and also avoid looking at like phone. That is half an hour, 1 hour before sleep. This is help to relax your mind and you can get into sleep better. And also of course in eczema patient, the skin barrier is very weak, so we avoid using all those very harsh products, those including SLS ingredients. We should avoid it as well.
What's SLS?
Some sulfate containing
Okay.
product. Yeah, and also you can do some gentle movement or white stress, wet two strenuous exercise. Okay.
Okay, so lifestyle is not about doing everything perfectly, but making it a routine so that the effect can be lasting. It's good for your health as well as good for your gut. Okay, so Dr. Jun, what if patient has tried all these approaches such as taking care of sleep, avoiding harsh chemicals, and also doing yoga for stress management, but still their eczema flare is very bad and the eczema keep coming back?
Yeah.
Anything that we offer
Yes.
in the clinic for them?
Yeah. Yes, definitely. And yeah, this is also this is a common scenario that we see in our daily consultation for our eczema patient. They have tried a lot of things but never see any improvement or the flare up keep on coming back. So at our clinic we do have some combination approach that helps the patient to face this eczema problem, to treat this eczema problem. Okay, so the first one will be blood test.
Yeah,
Okay.
drawing blood.
Yes.
Okay, what do we check?
Okay, so in blood test, we will check for inflammation.
Inflammation markers.
Yes, your
Okay.
body inflammation status.
Nutrition.
As well, such as like vitamin D, iron,
Iron.
yeah,
Okay.
and also hormones. Yeah,
Hormones.
all these is also can triggers our eczema problem. So we by blood test we can find out how is the inflammation status and is there any deficiency. Yeah, so that we can help you from there.
So from blood tests, after getting the full picture, after knowing which nutrients or hormones that the patient is deficient, we'll actually customize several nutrient supplementations. It can be hormones, it can be nutrients such as iron, vitamin B, vitamin D3, okay, to actually help to improve the overall health as well as the skin. So nutrient supplementation, customization.
Yes. Other than nutrients and also vitamin supplement, then the other thing is hormones. Okay. We do use some bioidentical hormones in helping our eczema patient as well, such as T3 for the thyroid support.
Thyroid hormones.
Yeah, thyroid hormones, and also like DHEA or hydrocortisone to support our adrenal glands. Yeah. Okay, and also like melatonin. Yeah, for those facing sleeping issue. Yes, all this by targeting all these issue, then it can help to heal the eczema flare up as well. Yeah.
Okay. So besides nutrients and also hormone supplement support, actually our clinic also has the advanced machines or technologies that can help to further improve or enhance the effect of skin stabilization. So such as hypothermia, which we launched last year, it can actually help to improve the immune system, especially the NK cells, and also help the body to detoxify more efficiently. Okay, and then the next one will be actually called Ondamen, which actually use the pulse electromagnetic field, okay, to actually reduce our body inflammation and energize the cell to speed up the repair mode of the cells. So they support your body from the inside, creating a healthier environment for your skin to actually recover. So these are the non-invasive modalities that we Revix Clinic actually provide. Besides blood tests, supplementation, so machines, technology-wise, we do also provide. Okay.
With all this approach, we will help to boost your effort, to help to heal the eczema more integratively. Yes.
So actually here in Revix, we do blood tests. We are checking what is driving your inflammation. as well as we help you to restore what your body is lacking, nutrients, hormones, and we support healing with advanced technologies treatment when needed. So this way we are not actually just calming or treating the superficial symptoms. We are working actually towards a more long-term skin stability and also a healthier you. Yes. So when you have a healthy gut, it actually signify healthy immune system, healthy skin as well. And also it will bring about healthy mind and good sleep as well. Okay? So all the treatments for eczema actually we focus not just on the superficial part, but more onto the inner balancing as well through nutrition, okay, through diet, through stress relief, okay, and then sleep, good hygiene, good sleep hygiene, and also of course advanced technology, hypothermia on that will help as well.
So now maybe we can see whether there is any
Questions from the
question
ground?
from the ground.
Okay, so there's one question here from Cheryl. Doctor, if my cream and moisturizers don't work, what's the next step?
Yes. So okay. So if you are on the flare up period and if you have applied some cream, moisturizer, maybe steroid cream as well, but it doesn't help. So to control the symptoms, how to say, faster, faster at that period of time, yeah, we can inject some steroid, okay, to calm down the inflammation. But of course, this is just the temporary relief of symptoms. Yeah, we still need to find out what is the causes behind it. Yeah, and from there we can work together and control the symptoms and reduce the frequency of flare-ups more effectively.
So the key here is actually still not just treating the symptoms with creams and moisturizers. The more important will be treating the root cause, that is your gut and immune system. So Cheryl, you may check whether you have all the signs of the gut microbiome. And are you on any supplements to support your gut? Because if you have eczemated skin, it's actually a sign that your gut is not so healthy. So you may take a deeper step into your gut health as well. Okay, so the next question by Cheryl. Okay, and sometimes I want to do skincare like exfoliating my skin. Is it safe? If yes, how often? Okay, so I assume Cheryl, you have eczema skin and you want to do exfoliating skincare on your, you want to put it on your skin. Okay, so eczema patients, they often have dry skin to start with, okay, because they have the skin barrier defect, and then they will have redness and then inflammation, itchiness during the flare. Okay, so actually we don't recommend patients to do exfoliating skincare, especially during the flare. Okay, and even during remission, we don't actually recommend as well, because just like what Dr. Jun mentioned, avoid harsh chemicals. So exfoliating skincare are actually harsh chemicals that can trigger off more dryness, more barrier defect that can trigger off the eczema as well. So I would say no exfoliation to your skin if you have eczema. Okay?
Okay. So the next question from Izati. Are there specific soap, detergent or fabric I should avoid? Okay, so for exact question, okay, so eczema patient, the skin is very
Fragile, yes.
fragile and dry. So avoid all those harsh product. Okay, such as just now what I mentioned is like the sulfate containing ingredient product. Yeah, and also try to avoid those forming kind of facial wash, or this can dry out our skin more easily as well. Okay, or fabric. About fabric, I would advise that you should avoid those synthetic fabric, okay, such as like polyester, nylon kind of clothing, because this will, how to say, it will damp our skin and trap all those sweat inside on top of our skin, and this will trigger the eczema more easily.
Okay. So next, from San PH, how to choose the probiotic? Okay, so there are a variety of probiotics in the pharmacy as well as in Shopee. Okay, so how to choose? Actually, probiotics, we are looking for certain strains that will help with your gut as well as your skin. So just like what I've mentioned before, choose those with lactobacillus bifidobacterium. But at the same time, you have to choose probiotics with prebiotics, especially you can look for those prebiotics that can culture the Faecalibacterium, which is the very rare kind of bacterium that is very hard to grow in our gut because it's an anaerobic bacterium. So gold kiwi is actually the prebiotic that support this Faecalibacterium, okay? And as well as this is the prebiotic gold kiwi, okay? As well as you look for those with lactobacillus as well as bifidobacterium to support your skin if you have eczema problem. So this is the specific strain of probiotics. And probiotics, just like what I've mentioned, 6 months of consistent taking. So some patients tell me they are not sure what are the strains of probiotics that they are taking. So another way you can check is actually besides reading the instruction leaflet, if you have been taking care of the same probiotics for at least 6 months but you see no improvement, so it's actually time to switch to another kind of probiotics that's more suitable for you as well as for your skin.
So the next question, okay, do I need to do allergic test? Okay, so this is a very common question from the patient. They will ask, maybe I should do allergic test and find out what is the food or what is the things that
I should avoid.
I should avoid. This one I should say that you doesn't necessarily need to do the allergic test, because actually most of the time because our skin is already very weak, so it could respond to a lot of things.
For example, dust.
Yeah,
my patient came and tell me, Doctor, I did the allergic test and I'm sensitive to dust. So how to avoid dust?
Yeah, it's very very hard. Then some certain tests, when the result come up, maybe it's something that you actually never touch it before and never eat it before as well. So like when our gut is already very weak, it's quite common sense that it will easily irritate by a lot of things. So if you want to avoid all these triggers after knowing the result, is actually quite hard for a lot of people. So the more important thing is you should
strengthen your immune
build
system,
your
gut.
gut, gut health, the barrier. Then from there, the triggers will be lesser.
Yes. So what Dr. Jun has mentioned actually makes sense, because when your gut microbiome is imbalanced, it can actually make you more sensitive, more sensitive to all sorts of things. So what you are sensitive to through the allergic test doesn't mean that you have to avoid all this, but it actually signifies that your immune system is very, very weak. So you have to tackle the immune system instead of you avoid the list of food or environmental triggers, which is very hard, especially for growing children when they are at the age of exploring and you try to limit all the foods. So how are they going to taste and learn through the way? So it can even lead to malnutrition, as what we have mentioned before, through the elimination diet. So avoidance is actually not key, but more to how to strengthen up the gut and immune system.
It should
Yes.
work
Mm.
together.
Yes. So any more questions from the floor?
Okay. So I think maybe that's all from the question from the floor for now.
Okay. So I hope everyone will benefit from our sharing today. And of course, if you are struggling with eczema problem since young or at any age, you are not alone because, of course, we know that it's very common, but there are actually solutions to it when we look deeper into the root cause.
Yes.
So if you have tried just superficial skin treatments but it doesn't work, do explore further into your gut health, and we are all here to help you. Yes. So do drop us any message or you can book us an appointment, okay? Then we will have a more detailed explanation into your problem with you.
Yes.
Okay? So thank you everyone for joining our live session today.
Yes.
Okay.
Thank you.
Thank you and have a
Stay-
good evening.
Yeah, and stay tuned to our Facebook page and also Instagram page for our next live session.
Okay.
Yes. Okay.
Thank you.
See you guys again.
See you. Bye.